Welcome to USMLE SARTI. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
Welcome everyone, and good morning, good evening to this special session where we are highly privileged to have Dr. Ruaa Elteriefi, who is the Program Director, Internal Medicine at formerly known as Beaumont Hospital and now Corewell Health. And she's an IMG or was an IMG herself. So we wanted to just sit down with her and get her thoughts on the match. So welcome, doctor. Good morning, and glad to have you.
Good morning, and thank you for having me, Juan. It's a pleasure always being here with you.
So let's just start with, the shirt you're wearing, Beyond Mommy, Mommy Program Director. Maybe a bit about your journey as an IMG, and then we go from there.
Yes, definitely. So I'm Ruaa Elteriefi. I'm originally from Sudan. So I am an IMG, proud IMG, and I will tell everybody, I understand, as a person who walked your same walk and been in your shoes, it's a tough journey. It's a difficult journey. So I graduated from University of Jazeera in Sudan, and I did what we call like my TY year and beginning of training there, and then I moved here. Coming here, there was a lot of struggles, finding a rotation, being, allowing it, every place you call, it's tough to get somebody who would take you, even allowing, for you to come in and see patients, all these HIPAA violations, HIPAA rules, and so on. So I understand it's a tough journey. Getting a letter of recommendation that's personalized, that represents you, is tough. Having a language and cultural barriers and differences. There's a lot of things we do that we are not aware that it's not, good when we're communicating here. So it's a lot of cultural shock that you come to, that you have to get accustomed to. But I will say it's worth it. You are worth it. Your family is worth it. So don't allow anybody to tell you, oh, no, it's tough, it's difficult, don't do it. No, it's worth it. You will do it. You will get to it. It's just a journey that you have to walk through.
So, we do have a lot of working women, and I've met your lovely kids as well. Tell me, how do you manage the work-life balance? How do you do it beyond mommy being a program director?
Yeah, so we wear many hats, right? A mom hat, a program director hat, a wife hat, a sister hat, and a teacher, doctor, everything. It's not easy, but what keeps me growing and going is, I guess, my drives. So I advise, even when my residents come for advice, and I say, you have to have your motives, and your drives that keep you, your why. What's your why that wants you? Why do you keep doing this? Why do you want to do this? And for me, it's my kids. I want my kids to grow up and be proud of who their mom was. I want to be a role model for females like me who go and see and say, oh, she's a program director now. She was able to do it. I want to do it. So those are my two big whys. Every time I see, a successful female Muslim entrepreneur going on, I'm so proud, and I say, okay, this is my why. So I hope to influence young generations, female generations, and I want to be a role model to my own kids. So keep your motive, your drive, your why in front of you every morning. And that's what's going to get you stronger. And I think moms actually have stronger reasons to do it. Don't you say, I have kids, I can't do it. No, you're doing it because of those kids. You're doing it for them.
And I assume programs like yours are very receptive to, working women and such.
Absolutely. We pride ourselves in having a good family life balance, work balance. And I always tell my residents, family comes first. You do it with them, you get to know them. We're proud of them and their families. So, and that's what I want for every resident in the United States, is to be proud of having a family. You know, we sometimes have, I get asked by females saying, hey, I'm getting an interview. Should I let them know I'm pregnant? I was advised to hide this, or not, bring this up, or not discuss family, or I have a kid, because then they will think it's a distraction. Actually, I think it's a strength, because if you're able to be pregnant and have kids and go through USMLEs and get great scores and be here, it's a strength for you. And a program that looks at it as a negative, I don't think you want to be there. So choose what you want.
All right, so let's now just dive into the match preparation and how IMGs should approach it. So looking back, the season just ended. Both the applicants and the program submitted their rank order list. What were some of the things that changed in 2024? For example, the ERAs, they had limitation of 10 experiences. Did it change anything on how you reviewed the applications?
So, I thought it will be much different, but so the 10 experiences, I think it did make it easier on us. Instead of going on a 10-year journey CV, it allowed the applicant to really shine what they think is important in their journey. And this is where you as an applicant have to be smart of saying, these are the things I'm choosing. It allowed them to even, so if you're applying to internal medicine, for example, but you did a rotation in peds and so on. So it allowed you to take that peds rotation out, so it doesn't really, confuse us by what is this person really wanting to do. So it allowed you to pick what you want to put there. And I see the smart applicants and how they can diversify where they are allowed even to put their volunteer work, their research work, their hobbies, and so on. That was the other thing that went away. Hobbies went away. So now I would advise candidates to, if it's a hobby that's worth speaking about, putting it in one of those experiences. That way they can get a full view of who you are as a person.
So basically the fluff went away.
The fluff went away, exactly.
Well, I'll come back to the multiple specialty conundrum that many of us have. But the next question, now signaling has, I guess, matured a bit in terms of this as being the second or the third season. I'm not sure.
This is the
How
third.
does that impact your review? Does it matter? Does it not matter?
Yeah, so when it first came out, we even as a program and program directors, we really didn't pay much attention to it. So I think I also kind of grew into how I will use it. And I had a discussion. Actually, we were in a conference with another bunch of other program directors, and I liked how they said they were choosing. So in the beginning, most program directors were looking at it and saying, okay, we can see if this person is really interested in us. For internal medicine, you have 7 signals. So I, from there, can know I'm at least in your top 7, right? So if I'm not in your top 7, then why would I want to bring somebody in and leave other people who are really interested in the program? So I will say this is how a lot of other program directors might disagree. And their program, they choose what they want from it. But I want, at least from all the people, I'm dealing with people who already like me and want to be in this residency program, because it's a mutual, love relationship. When you end up here, you don't want somebody who feels that this was their backup place or this wasn't really where they wanted. And I think most program directors are going to start doing that. If they're not using it for selection for interview, at least they will use it for selection for rank. Meaning I have 2 candidates that are the same everything for me. One signaled me, one didn't signal me. the signal person will go higher. So, and my advice for the applicant, I know it's tough. It's only 7 programs, right? It's only 7. But when you're picking those 7, be wise, meaning, yes, you have 7 places you like, but are those 7 places likely to take you? Do you see yourself being there? Do you fit there? So don't signal a place that won't even look at your application or give you an interview. That's a waste of a signal. So look at where your chances are the most and be smart about your signal.
No, you actually hit the nail on the head. It is very tough as an IMG, when they are hedging their bets, it's 200 plus programs they are applying. So I think what you're saying is research the program well, maybe do rotation, maybe do something else to show your interest in the program, right?
Absolutely.
Wow. Okay, so that was pretty much what we saw last year. Now looking ahead, at a high level, someone applying in September 2024 for the 25 match. What do you look for in an applicant? Always a big question. What does a PD want?
You know, it's not that it's not that full path. It's really just the fit, and meaning, sometimes we will get somebody who doesn't have high scores, but there are people that are teachable, that are self-reflective, and we know they'll grow up with us. And the opposite is true. Sometimes we have people who have high scores, they just graduated, they just came, but then they come to the interview and we just don't mesh well with them. We just can't communicate with them. So I think, in my opinion, having what it takes to get into residency and prove that you are a fit in that residency program is what everybody's looking for, right? So I would rather have somebody who has a little lower scores, but gets who we are, can communicate with us and with our patients and be friends with our residents, than to have somebody who's a high score, recent grad, fresh everything, but can't fit.
Yeah. So then the related question is, how do you assess commitment to this specialty? And the reason I'm asking you this is because there are many IMGs who will apply for multiple specialties, or they may have a home country residency in a different specialty. Now, IRAS is limiting us to 10. But we want to apply to multiple specialties. We don't want you to think that I am the backup. So how do you assess this?
Yeah. So there's, yes, absolutely. So their CV speaks of them, right? So if I see a CV that has surgery, and then they have a lot of publications in surgery, I will think, okay, they're really applying to surgery, but internal medicine is their backup. If they end up being interviewed by us, I will ask them, and we're very smart on interviews. We pick up body language and we pick up, and that, not to take away from people who might have had a career in something and then midway there, they felt this is just not for me. But you have to come and convince me on an interview. And then you had a second chance to change how your CV is speaking of you. So if you still put from your 10 experiences, 9 surgery rotations, and you chose to give me your publications that are surgery, you're not going to convince me. So if you are that person who changed their mind, let your CV speak of you. Now, for an IMG, I can understand when they're applying to both internal medicine and family medicine, for example, because their end goal is to be a primary care physician. But I can't understand applying to surgery and internal medicine. Those are just 2 different worlds. So I will be okay with, I see family medicine rotations, and if I see, peds part of family medicine rotation, with them saying, my goal is to be a primary care physician.
Yeah. Now let's move on and talk a bit about clinical rotations, USCE, and importance of all of this in the match.
Yes, okay. So we want a candidate. We practice all back home for some time or just a recent grad. We know that we practice differently. So why do program directors care about US clinical experience? They just want to know that you'll get to understand American healthcare system and how to practice in America. And that's where this rotation, the US clinical experience rotations come in. When you choose a US clinical experience rotation, you want to choose a rotation where you will leave with learning what you need to learn and a letter of recommendation that's personalized. Unfortunately now, I think with years and years of interviewing and the match cycle, we get to see letters that are copy paste letters that really are not personalized to the candidate. So we get to see, and we might put 20 letters next side to side, and we find that there's just literally copy paste of each other. And that's a waste of a rotation. It's a waste of their time and our time. So when you choose a rotation that you get an experience and you're learning from, and they can personalize your letter of recommendation to really speak of who you are. And that's how I can differentiate, candidate A from candidate B.
And then for those of us who cannot travel or don't have the visa or other issues, you're also offering didactic sessions only. So tell us how that works.
Yes, so if they can't travel, visa issues, or they're in a different state and they can't really travel, or they want to save money of expenses in housing and tickets and so on, they can choose between one of two options. So there's the once weekly didactics that happens where students are presenting their patients and there are many presentations. And then there's a second session that we are doing assessing their critical thinking. So I will give them live real patient scenarios without with de-identifying patient information. We're just saying this patient presented with so and so, and I'm picking on their brains, see what they will do next, and we walk through a case scenario. And I'm looking for all the students' participation, what they learned, what will they do different. And sometimes it's following the guidelines, simple, straightforward. And sometimes it's a question that's not in the guidelines. So do they know how to access literature and so on? Give them the patient, de-identified patient information. That way they go and they read about it and they come for a discussion.
And just for our listeners, all the rotations come with letters of recommendations.
Yes,
That's the
absolutely.
most important thing.
Yes.
Yeah. Okay. Yes. So I think the on-site 4-week rotation comes with 2 letters. If they do 8 weeks, it comes with 3 letters.
Yes,
Right? And the didactic sessions also come with your letters.
absolutely.
Okay. And for those of you who are interested, Aarti on our team can send you the link. You can set up time to discuss about Dr. Elteriefi's rotation. So Aarti, if you can do that, please. So Doctor, now let's move on and talk about the scores, the exam scores, whether it is CK or step 3. But first, before we go there, if someone has a pass fail versus a score on step 1, now are they equal, or a 260 step 1 is better than a pass fail?
Yeah, so I will say, for all fairness now, now that we're going to seeing a lot of pass, for all fairness, I think most program directors are blinding themselves to the score of step 1 and just putting pass, fail to whatever it is. But that's why now step 2 and step 3 matter more. Having a great score on step 2, and in addition, taking step 3 before your match cycle opens will add more to you. I had candidates who had maybe very similar profiles, and one just took step 3 before and one didn't, and this person had more interviews than the other. So because of that, step 2 and step 3 matter more now.
Okay. What about research? You know, we are seeing a lot of interest or whatever in research. How does that matter now?
So whenever somebody asks me this, I do ask them, what is it that you're planning to do? And where is it that you're planning to land yourself? So if they're going to a university base, a university program, if they are interested in a competitive fellowship, cardiology or GI, room, even HEMONC, then I will ask them, yes, then you have to put in the work and establish some research and publications. If their end goal is a community program, being a primary care physician, a case report here and there, just to know the basics of how to write a case report, and maybe a presentation in ACP meeting might be sufficient and enough.
Yeah. I'm sorry, I'm just, rattling off questions as I see them. But I am very sensitive to your time. Now let's get to some of the other issues. There are three kinds of questions that we get. First is, I'm an older year of graduation, but I may be working in my home country. So there are no gaps in my CV. Am I a competitive applicant? Do programs, how do they look at the year of graduation?
Yes, so there's always, I will say, don't allow anybody to tell you stop, don't even go here. It's worth trying. There's always a way for way out of everything. So for old graduates, there's preliminary programs, for example, that will take an old graduate as long as they met other criteria. There are programs that will say if they did US clinical experience and step 3, that will kind of blind them to the year of graduation. There's programs that have it cut off as a cutoff, done. I'm not. So you do your research and seeing where are the places that will take an old grad, and if it's through a prelim track, then you apply to a prelim track. If it's that what they're asking you is doing the US clinical experience in step 3 before applying, that might be your route. You just have to, at the end, prove to them that I'm not old school in practicing history of medicine. That's why I'm fresh. I did a US clinical experience. I have a letter that attests that I'm fresh in my knowledge and I still can take good care of my patients. If it's a score problem along with a year of graduation, that's where it might get a little difficult, but there's always a way. I will say, consult somebody who knows.
I'm sorry, but your program does have preliminary positions also.
Yes. Yes.
Okay. And the graduates of this preliminary year, where do they typically go? Do they go PG2, IM, FM? Generally, where do they go?
So each program has their, some of them apply for PGY 2 years, where they can go and apply right away. And some of them will apply into the match next. But this kind of gives them a big, it's as if you're getting a strong letter of recommendation with somebody who's been with you for months. It's not a 4-week rotation now. It's months and months in an accredited or a program.
Continuing with our discussion, one was the older YOG that you tackled. The other is actually a lot more, which is gaps. I had to take gaps because maybe I migrated to US, started a family, other reasons, right? So now, how can I improve? What do you want me to do?
Well, see, this was one of the things that I think changing the CV to 10 experiences kind of blurred in our eyes, because somebody might have chose different experiences where I don't have a full track. So I really can't see if there's a gap or not, because I might ask them, hey, what were you doing from 2016 to 2018? And you might have really been doing, clinical work at that time, but you just didn't choose that experience to say it. So I guess Eros helped you there.
Okay. What about failures and steps? I think that's a more serious one. I failed step 1 or CK. How do I improve?
So And I will say insight is what matters the most, meaning if you failed step one, you have to, step back and look and say, what was my problem? And figure out what your problem is and fix it. Because if you failed step one, but then you came back and you passed it, and then you figured out your problem and you got a 250 or 260 in step two, then I know you had a problem or circumstances, but it's no longer a problem anymore. So that's a person that it's okay. The problem becomes with a person who failed step one, then came back and passed it, and then barely passed step two, and then barely passed step three. That's a person who's not self-reflective, doesn't have insight to what their problem is. And they shouldn't have kept going. They should have got, somebody to coach them and help them with their test-taking skills to figure out what their problem is before keep going on into, this track of, oops, my light went off.
Yeah, that's I can see the light went, but that's okay. It happens. It's back. Okay, and I know we will hopefully do another session on interview preparation. It's too early to talk about those things. But as we wrap up, what are some of the common mistakes you have seen over the years in the ERA CV or the personal statement?
The personal statement, when it's too generic and really not a personal statement, not really speaking of who you are, is a big mistake. You're having an opportunity to sell yourself, to tell them what's unique about you. And a lot of candidates don't use that as an opportunity. They get this generic, interested in internal medicine. It's a puzzle. Nothing. Who are you? Why should I pick you? Is what your personal statement should be about. And in the ERA CV, believe it or not, there's still, even in this AI world, there's still grammar and spelling mistakes that happen that are just a big turnoff. There's maybe sometimes misrepresentation or empty. I don't know why this will happen, but these are the simplest, straightforward things you can do for yourself. So even if you have 10 eyes after yours to look at it, it's better than just, doing it last minute and submitting it with things that just won't help you.
I thought I would wrap up now, but you brought up an important point. In the last season, did you see a lot of AI generated texts in PS and CV, and you said, whoa, this is just Chat GPT. Was it obvious or no?
There were some that was obvious, and now we have, detectors for Chat GPT. It's difficult to say, is it a good thing or a bad thing? Did you give them the idea and then they just kind of made it look pretty for you? Or was it all generated by AI? Avoid it. That will just be my avoid it and get human eyes to look at it and review it after.
Yeah. We are over 2 minutes, but any last minute advice for students applying to the match in September 24? What would be your tips?
Prepare early. Know that the journey is not easy, and I'm telling you it's not easy, and everybody will tell you it's not easy. But I'm also encouraging you that you got this. You've already made it through all this time. You graduated medical school. You came through this whole time, so you will get it. Get all your things aligned early. See what you need. Is it U.S. clinical experience? Is it step 3? Don't let the hard journey kind of put you down. And you got this.
Well, thank you, Dr. Elteriefi. Much appreciate your time. This was excellent, and we hope to see you back again. And of course, if students have questions about your rotations, we'll let you know.
You are more than welcome. Thank you for having me.
Thank you, ma'am.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.